Hi there, welcome back to the channel. My name is Nurse Elizabeth. I am a nurse and I am a licensed registered nurse in the state of New York and New Jersey. I have lost over 90 pounds utilizing a GLP-1 medication, and I am happy to say I feel great. I also help people navigate side effects, GLP-1 use, and emotional, physical, nutritional guidance as well while utilizing a GLP-1 medication. If you are interested in working with me, the link is in the description below. You could also email me to find out more information as well. Free tracker for your shots are also available at GLP-1 Central. So let's dive in. So getting into GLP-1 side effects. A lot of people do have some type of a side effect on this medication. For some people, it's nausea. For some people, it's hair loss. For some people, it's like severe side effects. So in this video, I'm going to give you some tips on how to manage some of the more common side effects on a GLP-1 medication. Now, if you ever are experiencing any severe side effects, extreme stomach cramping, extreme nausea, extreme vomiting, extreme diarrhea, you want to seek medical attention immediately. Call 911. You should not be watching this channel. Okay, so and make sure to always report any side effects to your physician. And while I am a medical professional, I am not your doctor, so please always ask your doctor before taking any medication, changing any medications, etc. Okay, so some of the common side effects on a GLP-1 medication include constipation, nausea, diarrhea. And so for constipation, what you want to do is, first of all, make sure you're getting enough water, because that is one of the common culprits of constipation, is that fluid helps to push the food out of the system. And without it, your body is going to hold on to water because it wants to stay alive, and therefore also hold on to, everything else in your body as well. So this could also be a culprit of weight gain, and people think that they're gaining fat, but they're actually just having this side effect. If you're going to utilize anything over the counter, a stool softener, a laxative, polyethylene glycol, things like that, do it at the discretion of course, your healthcare provider, because keep in mind, these things can, while they do help to manage it, you don't want to develop a dependence on it, and you do not want to develop any other issues or dehydration from it as well. The next thing I'm going to educate you on when it comes to that is to make sure you're having enough fiber as well. So make sure that you include fiber in your diet, and that's like around 25 grams of fiber, and to keep making sure that you incorporate that daily to prevent the symptoms. So the next side effect I'm going to talk about is diarrhea. Diarrhea is usually, I actually have an article about this on the website. You can also check it out. I might link it in the description below as well. So you want to make sure that you're just to prevent, an upset stomach, diarrhea, things like that. Again, you want to be making sure you're not eating too many fried or sugary foods while you're on a GLP-1 medication, because that will exacerbate that side effect. And in the case you do have diarrhea, the biggest risk of it is losing electrolytes. Same thing with vomiting, is the biggest risk is losing electrolytes. I do utilize, like, if I ever felt felt like I was dehydrated, my favorite go-tos, I used to love vitamin water zeros, and I do have some good ideas for dehydration, and how to, like, some good hydration products. You could look at them in the link below. But any types of electrolyte beverages are good as well. You don't want to just take electrolyte beverages at random, because if you're not dehydrated. And this is where blood work really comes into effect. You want to see what your levels are at. You want to make sure nothing is severe or nothing else is causing these problems and it's not a side effect of the GLP-1 medication. Next, you want to just make sure you're, really it's again with diarrhea, sometimes you might have constipation, and the constipation can lead to diarrhea once that's taken care of. So do keep that in mind. If you feel it is severe, again, please contact your healthcare provider. So the next one is nausea. So different ways to combat nausea is to make sure to is ginger. I actually used to smell like, this is a weird thing, this is not science at all, but I used to smell horseradish, and for whatever reason that helped with my nausea. Sometimes eating helped, and sometimes eating a small amount even, and as well as just having some water and making sure that I didn't overeat at a previous meal helps to manage nausea. Also, not having your meal too close to bed can help manage with the side effect of GLP-1 nausea. So definitely, like I said, all symptoms should be discussed with your healthcare provider. If you'd like to know more, I have tons of articles at this at glp1central.com. I do hope you check us out. The link is in the description below for all the websites and all the things we discussed. And I can't wait to see you in the next video. Have a good one.